Hello and welcome back to Carri's Clinical Corner. In this episode, we're going to talk about Kegels because there's so many misconceptions around Kegels. And the number one thing I hear, especially from women, is Kegels are it. This is what we have to work on, right? And even from my men, they think Kegels are it. But there's so much more to pelvic floor therapy than Kegels. And so what I want to say up front is in the clinic, I would say many more of my patients come in with tight pelvic floor muscles rather than weak pelvic floor muscles. So if your muscles are tight, a Kegel is a strengthening exercise, so we don't need to make a tight muscle tighter. And I think these are misconceptions of the patriarchy, right? Of like, you got to keep your vagina tight. It's probably too tight. And if it's too loose, there might be other reasons for that. So Kegels are not the only thing we do in pelvic floor therapy. So what are Kegels and why is it called a Kegel? So back to this model. So here's your pelvic floor muscle. So again, female model. So a Kegel is tightening these muscles. So it's just a contraction of these muscles, just like you could contract any other muscle. Why are they called Kegels? Because Dr. Kegel discovered this, and usually in science and medicine, if you discover something, you get to name it whatever you want. And so he named it after himself, and he taught women after pregnancy to do this. And then it became like, Kegels are it, this is the thing. And a lot of my clients after pregnancy, they are weak, and they do need to work on this for a while. So especially with a vaginal birth, come here, model. With a vaginal birth, all of this got stretched out, so of course it's a little bit weak. And normally, over 3, 4, 6, 8 weeks, this is going to go back to normal, back to baseline. And if it doesn't, that's when you need help. But many of my clients come in and their muscles are too tight. And so a Kegel, remember, is tightening these muscles, strengthening them. So if your muscles are already tight, we don't want to do Kegels. And I would say very rarely for my men do they need to do Kegels, only after like prostate surgery or if they have bladder leakage. But if you have pelvic pain, male or female, like no matter what gender you are, you don't need to do Kegels. I almost can guarantee it. Sometimes, I will say a caveat to this. In the clinic, sometimes I teach people Kegel exercises, but for the reverse purpose. So it's hard to tell your muscles to relax, right? Like, what does that mean? And like, I think we have some things, but have you heard of progressive relaxation exercises? So you like tense your muscles and then you relax it. So sometimes I use Kegels for that reason for my patients who have pelvic pain, but only for them to have the awareness to relax. We're not doing like hundreds of Kegels. I also would say nobody should be doing hundreds of Kegels in a row, right? When I teach people to do Kegels, if they need it, we do it in a controlled manner. Like, if you go to the gym to work out, you're not just like pumping your biceps, right? Like, that's not really effective. So why do we think that's how we should do Kegels? Because that's what's out there. No, if you're gonna do Kegels, be very intentional about it. Squeeze, relax, squeeze, relax. See if you can hold it, right? Like, our pelvic floor muscles are actually like 70% endurance postural muscles and then 30% quick contraction muscles. So I teach people like, how long can you hold it? But not this like on off, like, let me just do 100 reps. Like, stop that shit. And then also I should say, we don't necessarily want to do Kegels on the toilet. So sometimes you'll hear like, do Kegels on the toilet, like try to stop your urine stream. And I say, yes, that's a good test. If you can completely stop your urine stream, that's good. Your muscles are probably strong enough. But we don't want to do that every time we go to the bathroom, because what happens, our brain and our body get confused. And then we try to pee and then it's like, oh, we can't. So you could test that once in a while, but don't do that every time you go pee, because that's not a good habit. And then you're going to have the opposite problem. Things are going to be too tight. And if you need to do Kegels and that's the only time you think about it, I tell people like, go to the bathroom, finish peeing, pooping, whatever, and then practice your Kegels after that, because it makes sense, like on the toilet, that's where you think about it. So that's where you do it, but do it after the fact. Test it on occasion, but don't make a habit of doing that every time you pee. And then what about pregnancy? So there are some birth education classes out there that teach you like you should do 100 to 200 Kegels a day. Absolutely not. If you want to gain awareness of your pelvic floor, do some Kegels, but I hardly give anyone 100 Kegels a day, because your pelvic floor muscles are part of your core if you watched my previous video, and they are getting exercised every time we move, so we don't need to do 200 Kegels a day. For some people, that is the protocol. For my men after prostate surgery, they need to do like 120 Kegels a day. That's sort of like the conclusion we've come to. But they have a very specific pelvic floor problem. They had surgery, it interrupted the nerves, it interrupted the muscles. If your muscles are functioning fine, do not do 100 Kegels a day. But yeah, so in pregnancy, I rarely give Kegels, because if you want to have a vaginal birth, we don't want this to be tighter. When it comes to give birth, we need this to relax and open. So sometimes if my moms have bladder issues during pregnancy, yeah, I'll give them Kegels. But if they're just having a normal pregnancy and they're feeling fine, no to like 100 Kegels, no. If you want to practice a few to have awareness, great. But actually what I practice with my moms in the clinic, my pregnant people, is how to push properly. So, you know, these people probably aren't in my clinic till after they give birth, but a lot of like gymnasts, dancers, like models, people who need to be like high and tight, keep everything in, right? Their whole life, everything's sucked in, pulled in. Their pelvic floor is probably freaking tight, and you're trying to push a baby out of that. It doesn't work. Don't do more Kegels. But for those people especially, but for anyone, what we practice in the clinic is, can you do a Kegel, and then can you push? And so, and I practice this with my hemorrhoid and constipation patients too, is can you push properly? So when we push, whether it's pee, poop, a baby, we want these muscles to be relaxed and to open. They push out, and there is a little bit of movement outward. So a Kegel is sort of like pulling up and in, and the opposite, pushing, is the other way. So the muscles need to stay relaxed while they push. And one other thing, I could probably make like 7 billion videos about Kegels. So if you have more questions about Kegels, put them in the comments and I will make more videos about Kegels. But one other thing I want to say that I see commonly is a Kegel is much less than what we think. Like a Kegel, a proper Kegel, is we're trying to isolate just these muscles. So most people in the clinic, especially if they're having bladder leakage or they're having issues, they're working way too hard. And they're not only doing a Kegel, they're sucking in their stomach, they're squeezing their butt, they're squeezing their inner thighs together, they're using everything. And so when we do Kegels, proper Kegels, we're trying to isolate that. So again, in real life, our pelvic floor muscles work along with our core and our other muscles. They don't really work in isolation, but if they're very weak and we try to train them in isolation, right? Oh my gosh, I could go on and on, but let's just leave it at that for today. So let me know in the comments what questions you have about Kegels, and I'll make some more videos about that. And if you have any other topic requests, also put those in the comments and we'll get back. And thanks for joining me at Dr. Carri's Clinical Corner.